Next, I show the hybrid breast reconstruction after mastectomy. In implant-based reconstruction, steps of deformity and rippling are very common. At the second stage, combining the CAL with the implant can be refine the breast contour for a more natural result. Here is a long-term case of hybrid reconstruction. Ultrasonography and MRI show that grafted fat remains over the implant for a long time. So we also have tried whole breast reconstruction using multiple CAL sessions. However, the original CAL requires large amount of fat for each session. So for example, grafting 300 cc require another 300 cc for cell isolation, increasing donor site burden. To address this limitation, we introduced cultured CAL. A small amount of fat in cultured in advance. Through 3 passages, the expanded cell are cryopreserved until the day of surgery. This new approach reduces the harvest volume and the donor site burden. This slide compares stem cell number in simple fat grafting, original and cultured CAL, and excised fat tissue. In simple fat grafting, the cell concentration is relatively low. In CAL and cultured CAL, extra stem cells are added to the aspirated fat. Our goal is match native fat in ASC concentration and improve clinical outcomes. So here I'll touch on the regulatory framework in Japan. The Regenerative Medicine Act ensures the safety of cell-based treatment. Very notably, cell culture can be outsourced to licensed facilities. This unique legislation enables institutions without cell processing room to provide regenerative therapy. In our hospital, 8 weeks before the reconstructive surgery, a very small amount of fat is sent to our outsourcing company. The cultured cells are cryopreserved there. So on the day of reconstructive surgery, the cells are returned to our hospital. After fat is aspirated and separated by centrifugation, it's combined with the cultured cells. This ASC enriched fat is then injected into the breast. So this procedure takes about 1 hour and greatly reduces the operation time. So here is a treatment flow for whole breast reconstruction using fat alone. Fat grafting is repeated as the expander is gradually deflated and lastly removed. Depending on the breast size, 3 or more sessions may be required. Careful patient selection is essential. This case completed reconstruction with fat alone after 2 sessions. At the second stage, the expander was removed. So to conclude, cultured CAL achieved outcomes comparable to conventional CAL. It also requires less harvested fat, reducing the donor site burden. However, a longer follow-up is still needed to confirm safety and efficacy. In closing, I'd like to express my gratitude to my co-workers. Thank you for your attention.
Hello. Thank you, Dr. Yuko. Next presentation, please, Dr. Antonio Santoro Silva from Spain. The topic from traditional to tissue relevant approach, new paradigm breast augmentation.
Okay, good morning. Thank you very much again. I want to thank all the organizing committee for the invitation. This is our last presentation. It was okay, I think. I think it is really nice, it is. Okay, so now we have a lecture about the evolution from traditional breast surgery to tissue preserving approaches. Yesterday we had the opportunity of sharing our experience in preserve and other kind of procedures. Now they will gonna share the basic techniques for breast augmentation and breast augmentation mastopexy. I think it was recognized before. Okay, I think it is recognized. Okay. It is recognized. Okay. Thank you, sir. Well, these are my disclosures. I'm a KOL for Establishment Labs for Latin America, Europe, and APAC. And as open surgeons, we know that we have a long learning curve, that we should analyze our cases. And of course, we should improve our surgical technique, learning from our mistakes. This is something of humble we should have